Right now I'm going to cover the buccal lozenge, I'm going to cover the nose drops, I'm going to cover the eye ointment, the sublingual drops, the inhaler, the guaifenesin liquid, and Debrox ear drops. I'm also going to use the aero chamber with the inhaler. So first thing I'm going to do is I'm going to go to the MAR. I'm going to check for the patient. If it's the first time that I'm administering these medications, I'm going to check with the original doctor's order, the MAR against that, make sure it's complete. I'm going to get on the MAR and I'm going to look at all these medications. I'm going to assess the patient's allergies, the history of allergies. I'm going to look at their medication history. I'm going to look for any medication contraindications, any reactions, drug-to-drug interactions. I'm going to look up these medications, look at some background information on them so I can tell the patient side effects and that kind of thing when I go into the room. So first thing I'm going to do is I'm going to go ahead and get each of these medications out of the dispenser here. I'm going to check them against the MAR. I'm going to make sure it's the right medication, the right dose, the right route. So I'm going to check it the first time when I get it out of the dispenser, and also whenever I have to place it in the cup or like when I get it out of the box, I'm going to check it a second time. So I'm going to left with hydrochloride. This is right. I'm going to get it out of the box. Check it again. Yes, it is the right medication, right route, right dose. I'm going to get Codalamin out. Yes, it's the right medication, right route, right dose. Check it again whenever I get it out of the box. Yep, that's correct. Get the inhaler out. And all these things, I'm also going to check the expiration date. I forgot to mention that. I'm going to check the expiration date on all of them. So I'm going to get this albuterol out. I'm going to check it against the MAR. And I'm also going to check it against the MAR one more time before I put it in here. Here's my ciprofloxacin eye ointment. So I checked it against the MAR. Right route, right dose, right medication. I check it again when I get it out of the box, and it is right. Guaifenesin, yes, it's the right medication, right dose. On this one, I'm going to have to perform a calculation. So I see that I need 200 milligrams of guaifenesin, and it comes in 200 milligrams per 5 milliliters. So I perform this calculation, double check it, okay? And since it's 5 milliliters, I know that I'm going to need a cup and I'm going to need a syringe for administration. So I'm going to take that with me. And I'll check this one a second time whenever I pour it into the cup. And now I've got my Debrox. I check it to make sure with the MAR. It's Debrox, right route, right dose. It is. So I'm going to check it twice here. And now I've got my nicotine lozenge. I check it. Yes, I check it twice. Okay, and then I gather all my supplies and I head into the room. Okay, so now I'm going to head into the room. So hi, my name is Dusty. I'm going to be your student nurse today, and I'm here to administer some medications. So I'm going to perform hand hygiene. I'm going to put my gloves on. So at this time, a good thing to do is to perform any pre-administration assessments I need to do. So if I need to do blood pressure, I know I'm going to administer ear drops. So I'm going to look in their ear and make sure they don't have a perforated eardrum. I'm going to look at their eyes. I'm going to make sure there's no crusties. So this is a really good time to get any crusties out or anything like that. And if I do have to get crusties, I'm of course going to change my gloves and perform hand hygiene and put new gloves on. So after I've done that, I am going to check their name and date of birth. Can I get your name and date of birth? Perfect. And I see there's an allergy bracelet here. Do you have any allergies you need to be aware of? And they're going to tell me about their allergies. So first I am going to administer your eye ointment. So it's a ciprofloxacin. It's for your conjunctivitis. Something that you might experience with those is you might experience some blurred vision. And that's the biggest side effect that you should be aware of. That's pretty normal. So I'm gonna put this ciprofloxacin in their lower conductival sac from inner to outer cutis. All right, and I'm gonna wipe off any excess medication from their eye with this. I'm then going to go ahead and do their albuterol inhaler. So I'm going to let her know, this is your albuterol inhaler, it's for your asthma. Some side effects you might experience with this is some shakiness, some tremors, some anxiety. That's normal. So I'm going to have her set up, and I'm going to have her tilt her head back. I'm going to make sure she knows how to use it and that she's able to use this inhaler. So I'm going to let her know to put it 3 centimeters in front of the mouth and push down and inhale for like 3 to 5 seconds, and then to hold it for 10 seconds. And I'm going to let her know that if she has to do more than one puff, to wait like 20-30 seconds between puffs. So I'm going to make sure that she can do this. I know that she has a history of using this inhaler, so I'm going to probably observe her doing this. If she does need a aerosol chamber, then I have it here. And the difference in directions with that is I'm going to put it on here. And instead of having to do it at the same time, they're just going to have to suck slowly. Still, they're going to have to wait for 10 seconds and hold their breath 10 seconds and stuff like that. So that's the difference with the aero chamber. So I'm going to go ahead and administer this, make sure she's got her head tilted back, and make sure she can do it okay. And with this, it's not a steroid, so she doesn't really need to rinse her mouth out or anything. So that was the albuterol inhaler. I have to make sure one more time with the MAR that it is the correct medication, so I am checking a 3rd time before I administer these medications. And now next I'm going to do the cobalamin sublingual drops. So this is cobalamin, it's for your pernicious anemia. These are sublingual drops, so they're going to go underneath your tongue. A side effect that's coming with this is red urine, so don't be alarmed if you go to the bathroom and it's red. So with these, I'm just going to lift up the tongue and place 3 drops under the tongue. And I'm going to let the patient know they can't drink anything for like 10-15 minutes. That's a big thing with the sublingual drops, so they can dissolve. I'm going to administer the nose drops, so the phenylephrine hydrochloride. I'm going to let the patient know that with these, they're going to have to lay on their back for a little while, so I'm going to ask them if they need to go to the bathroom first. If so, I'll go ahead and go do that. And with these, I'm going to assist the patient to a position with their heads back, so perhaps a pillow behind their back or their head laying off the bed. And I'm going to administer these nose drops, 2 in each nair. 2. So they're going to have their head laying back and they have to lay there for a little while. Some side effects of phenylephrine that I'm going to tell them about are it's going to kind of burn a little bit when it goes in. It might cause some shakiness, anxiety. Nose drops. Now I'm going to administer the guaifenesin. I'm going to let the patient know guaifenesin is for their cough. Some common side effects with this are it might cause like some nausea, some vomiting, but those aren't really common. And also, they can't drink it with alcohol. So with this one, like I said, I'm going to check it, of course, against the MAR one more time as I'm pouring it in this cup. And since I have to do 5 milliliters, I'm going to use a syringe. So I'm going to palm the label of the guaifenesin. I'm going to pour it in the cup. And then I'm going to use the syringe to put it in another cup and get a really good accurate measurement. So here's my other cup. I'm going to do this eye level. So I'm going to do 5 milliliters. Sorry. Okay. And then I'm going to have the patient sit up. With this, it's a liquid medication, so definitely will have to have assessed for gag reflex, their ability to swallow. That's really big with oral medications. So have them sit up and have them drink it. Make sure they don't aspirate on it. And then after this, you go ahead and do the nicotine lozenge. So I'm going to tell the patient this is a nicotine lozenge. It is for your nicotine withdrawals that you can't smoke while you're in the hospital. Some things to expect with this, it might cause your heart to race, and also it might irritate your mouth. This is a buccal lozenge, so it's going to go in your cheek. So I'm going to tell them they can't chew it, make sure they don't swallow it, make sure they let it completely dissolve. I'm going to tell them they can't eat or drink for like 10-15 minutes after they use this, much like the sublingual drops. So I'm going to go ahead and administer this. I'm going to put it in the pouch of their cheek, and I'm also, whenever I document, I'm going to make sure I try to switch the side of the cheek each time, that way it doesn't become too irritating to their cheek. So that's the nicotine lozenge. Finally, I have the rocks. This is the ear drops. So I'm going to check it against the bar, like I have with all these medications for the third time. And I'm going to put 3 drops or 5 drops in the left ear. And I'm going to tell the patient that this is to remove the earwax in the left ear. The patient's been experiencing some hardness of hearing, so I'm going to let them know that. And I'm going to tell them they have to lay on their side for a few minutes. So once again, toileting, anything they need to get up for. So I'm going to assist the patient to the lateral side. I'm going to pull the ear up and back because it's an adult. I'm going to administer these eye drops in that left ear, or these ear drops, sorry, in the left ear. So 1, 2, 3, 4, 5, making sure to pull the pin of the ear up and back, and let them know they have to sit there. And of course, I would not administer this if they had a perforated eardrum, and there's really no side effects with the rocks. I would have made sure that it's not cold before I administer it. That's a big one. So now that I have administered all these medications, I am going to ask the patient if they have any questions. If not, I'm going to remove my gloves, perform hand hygiene. I'm going to document the medication administration of everything. I'm going to leave the room, and later on I'm going to come back. I'm going to assess them, make sure they don't have any adverse side effects. I'm going to document the way they react to medications, no allergic reactions, and that sort of thing. Today I am going to administer Timolol eye drops. So the first thing I'm going to do is I'm going to go to the MAR. If this is the first time I'm doing the medication, I'm going to check the original order with the medication and administration record. So I'm going to pull up this medication. I'm going to look some information up about Timolol so I'll be able to tell the patient a little bit about it. I'm going to check all of the other medication, make sure there's not going to be any interactions, and then check for allergies. So I'm going to get this medication out, and I'm going to check it against the MAR. Yes, this is Timolol. It's the right route, right dose, right medication. So that's the part of my 6 types of medication. So I check it. I'm going to check it twice here, make sure. So this is the second time. And then I'm going to prepare to go into the room. You pause it. I'm going to head into the room with my drops. So I'm going to knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. I'm going to perform hand hygiene and put my gloves on. Can I get your name and date of birth? Okay, thank you. Are there any allergies that you have that I need to be aware of? No? Okay, great. I'm here to administer some eye drops. This is Timolol. It's for your glaucoma. Whenever I administer them, it might burn a little bit. You might have some blurred vision, so those are some things you can expect. I'm going to look at their eyes and make sure there aren't any crusties or anything. I'm going to assess for that, and if there are, I'm going to go ahead and wash those off, washing from inner to outer campus. And if I do that, I'll have to change my gloves and perform hand hygiene again. If not, I'm going to go ahead and administer the eye drops. So I'm going to make sure that the patient's lying on their back. I'm going to tell them that they need to look up as I pull down the lower eyelid to expose the lower conjunctival sac. So these have been ordered, 1 in each eye for the glaucoma. So I'm going to do 1 in each eye. I'm going to tell the patient they can blink now. I'm going to wipe away any excess. I'm also going to press on the lacrimal glands to make sure that they don't run down the nose and become systemic. I'm going to do that for 30 seconds. So I'm going to wash it off if there's any extra. I'm going to ask the patient if they have any questions. If not, I'm going to take my gloves off, perform hand hygiene. I'm going to document everything. I'm also going to let the patient know that I'll be back here in about half an hour to reassess and check to make sure they don't have any symptoms or any adverse reactions. So I am going to give furosemide to my patient. So first thing I'm going to do is I'm going to go to my MAR. I'm going to pull up the original orders and compare them to the MAR. This is the first time I'm giving the furosemide. I'm going to look at the patient's chart. I'm going to look for a history of allergies, their medication history, their medical history. I'm then going to look up some information about furosemide, some side effects. That way I can tell my patient that information if they ask. So I'm going to come and I'm going to get the furosemide out of the dispensing system. I'm going to check it against my MAR, make sure it's the right medication, right route, right dose. It is. And I'm going to grab a cup to put it in. And before I put it in the cup, I'm going to make sure it's the right medication, right route, right dose. Put it in the cup. I'm going to prepare to go to the room. So I'm going to head to the room. Knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth?
Because I didn't.
Okay, good. Do you have any allergies that I need to be aware of? No? Okay. I'm going to perform my hand hygiene and put my gloves on. Ms. Campbell, I am here to give you some medication. This is furosemide. It is for your high blood pressure. Some side effects that you might experience with this is that it might cause some dehydration, because what it does is it's a diuretic, so it makes you lose some fluid to lower your blood pressure. So we're going to monitor that. So what we're going to do is we're going to give this with some applesauce or with some pudding if you prefer. Do you have a preference? You want applesauce? Okay. So I'm going to crush this up and I'm going to put it in your applesauce for you. I'm going to get my pill crusher. I'm going to put my pill in the pill crusher. And before I do that, I'm going to make sure I check the expiration date, of course, and make sure it's not expired. And right before I do this, I'm going to check this third last time, make sure it's the right medication, right route, right dose, and it is. So at this point, I have my right patient. I've checked for my patient. I've checked my medication, right route, right dose, and I do know that it's the right time of administration. And at the end, I'm going to document. So those are my rights of medication administration. So I've crushed my pill. Okay, I'm going to give it with applesauce per her request. So I'm going to put about a bite of applesauce in a cup. I don't want to put too much medication because they may not, or too much applesauce because they may not eat all the applesauce. So, okay. And also I want to make sure it's not her favorite food because it might cause her to not like the food anymore if the medication changes the taste of the food. So I'm going to mix this medication up with the applesauce really well. And I'm going to, before I do all this, I'm going to check and make sure that Ms. Campbell has a gag reflex. That's really important for all medications to make sure she doesn't aspirate. So I'm going to make sure she's sitting in an upright position, completely upright, before she eats this applesauce with her medication in it. And if she's able to do it herself, I'll let her do it herself. If not, I'll feed it to her, and I'll make sure she eats all one bite of the medication and the applesauce. And after she does that, I'm going to take my gloves off, perform hand hygiene, and I'm going to go document the administration of this medication. If for any reason she refused to take the medication, I would also document that at this time and the reason for the refusal. I would let Ms. Campbell know that I would be back after I documented. I would be back here in about 30 minutes to come check on her and make sure she's doing okay. And when I come back, I would, of course, make sure she doesn't have any side effects. And I document my nurse's notes, any adverse reactions. I'm going to demonstrate the application of nitroglycerin ointment. So the first thing I'm going to do is I'm going to go to the MAR. I'm going to check the MAR against the original order because this is the first time I'm giving the medication. I'm going to check the patient's medical history, their medication administration history, and I'm going to check for allergies. I'm also going to look up some information about nitroglycerin, some side effects that I can tell the patient. So I'm going to go ahead and get the nitroglycerin out of the dispensing cart. I'm going to check it with the MAR to make sure it's the right medication, the right route, the right dose, and it is. So I'm going to go ahead and gather my supplies. I need gauze, a wash rag, gloves, nitro paper, some tape, a marker. I'm going to gather that, and before I leave, I'm going to check against the MAR. This is the second time, make sure this is the right medication, right route, right dose, and it is. So I'm going to go ahead and head to the room. Knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Okay, thank you. I'm going to check that against the MAR, of course. And do you have any allergies that I need to be aware of? No? Okay. Right now I'm going to put on some nitroglycerin paste. What it's for is for your chest pain. It's like a paste that you put on a piece of paper. I'm going to put it on your chest. And some side effects that you might experience whenever you're using this: it might cause a racing heart and it might drop your blood pressure. So we're going to go ahead and keep checking your blood pressure while you're using this, okay? I'm going to perform hand hygiene, put my gloves on. I'm going to make sure that whenever before I apply this, I want to check to make sure if they already have one on. I'll take it off and I'll wash the medication off. And even if this is the first time, I'm going to go ahead and wash their chest. I'm going to assess at this time to see if their skin has any breaks in it. And if it does have breaks, I will have to use sterile gloves instead. So I'm going to go ahead and wash the skin off. Okay, and then I'm going to get the medication. I'm going to check with the MAR. This is the third time I'm checking to make sure it's the right medication, right route, right dose, and it is. And I see that the medication administration record says that I need to put 1/2 inch on this paper. So first I'm going to write on the paper my initials, the time, and the date. So then I'm going to put 1/2 inch on the piece of paper. And whenever I put it on the chest, I'm going to make sure it doesn't get on any hairy areas or sensitive areas. So stay away from the nipple or things like that. So I got 1/2 inch on here. And whenever I apply it, I'm going to make sure that I don't rub it in. I'm just going to stick it on here. I'm going to get gauze and apply it over the patch. I'm going to tape it on. And I'm also going to ask the patient if they've ever had a reaction to any lotions or creams before. This is a topical medication, so that'd be a good thing to ask.
You're going to apply it into the vaginal against the posterior wall, and you're just
Alright, and then I'm going to remove my gloves and perform hand hygiene. I'm going to document the administration. I'm going to document where I put it and the time, the date, and everything. And then I'm going to let the patient know that I'll be back here soon to assess them. Something I'm going to assess with this is I'm going to assess their blood pressure. So I'll come back and I'll assess them and make sure there's no side effects. And if they have any reactions, I will document those in my nurse's notes at that time. Okay, I'm going to demonstrate the application of a fentanyl transdermal patch. So the first thing I'm going to do is I'm going to come to the MAR. I'm going to check the MAR against the doctor's original order since this is the first time I'm administering the medication. I will pull up the patient's MAR and I will look at their medication history. I'll pull up their health history, their medical history, and I'll also assess for allergies on their medication administration record. I'll also look up some information about the fentanyl, some side effects and things to tell my patient to be aware of. And since this is a narcotic, I will have to get the assistance of another RN to sign off for me with this medication before I get it out. So I'll go get the other RN. We'll come and get the medication out of the dispensing system. She'll sign off and we'll count and everything that you have to do with narcotics. So at this time, we'll both check with the MAR, make sure, yes, it is fentanyl, the right dose, the right, so it's a fentanyl patch, so make sure that it's the right medication, route, and dosage, and it is, and I'll double check it a second time. Yes, it's right, so then I will be ready to head into the room. So, knock, knock, knock. Hi, my name is Dusty. I'm going to be your student nurse today. Can I get your name and date of birth?
Mildred Campbell, 8350.
Okay, perfect. What I'm here to do is I'm going to put this fentanyl patch on. It is medication to help your pain. It goes on your arm. Some things that you might experience with this medication is it might cause some sedation, some weakness, and dizziness, so be aware of that. It can also make your breaths kind of decrease, make it slower breathing, so I'll come in frequently and I will look at your breathing and we'll keep an eye on that. So I'm going to perform hand hygiene and put my gloves on. I'm going to assess the skin, make sure there's no breaks, of course. If there are breaks in the skin, I'll have to use sterile gloves.
And I have performed proper
I'm
hand
also
hygiene
going
protocols
to
because my
look
team likes to go.
everywhere on the
So,
skin, take
I
off
want
any
you all to
old
learn to
fentanyl
watch me
patches
have,
so I don't cause an overdose. So I'm going to look for those, and if there is one on there, I'm going to take it off, fold it in half, and put it in the black bag, and have another nurse witness that wasting of a narcotic. So I'm going to wash the skin off, and I'm going to make sure that I don't place this new patch at the same side as the old patch. You have to wait at least a week before you reuse the same site. So I'm going to wash their skin off and make sure I don't place on any hairy, oily areas. And before I put it on, I'm going to check the third time to make sure, yes, it is the right medication, right route, and right dose. So I'm going to open the medication.
I cannot put this into
I'm going to write my initials,
I would take
the date and the time
have it in my hands. Be sure to put it in.
on here.
Perform proper prenatal care if need be beforehand. And
I'm going to apply it to the patient's arm.
if there was any
I'm going to make sure I don't touch
be
the
sure to get that
bottom,
out
of
the way.
course. I'll try to make
Put
sure I
it
just
on
touch the
towards
edges only.
wall of the rectum.
Place it on the arm.
Boom, boom, boom. Make sure
I'm going to
that
hold it for
everything
30
is okay.
seconds.
Like clean it up if need be afterward. And,
I'm going to tell the patient to make sure, you know, if they have a heating pad at any time, don't place it over that. It can cause it to absorb faster and cause a stronger response. That's something to be aware of. And after that, I'm going to take my gloves off, perform hand hygiene. I'm going to document the administration of the medication. I'm going to, like I said, have the other nurse sign off. And I'm going to let the patient know that I'll be in here pretty soon to check on them and to let me know if they have any problems. I'm going to demonstrate the administration of a miconazole vaginal suppository. So the first thing I'm going to do is I'm going to come into the MAR, I'm going to check the MAR against the original orders to make sure that's complete. I'm going to pull up the patient's history, their medication history, their medical history, and their history of allergies. I'm going to check for that. I'm going to pull up information about the drug, about the miconazole, for side effects and anything I need to be aware of to be able to tell the patient. So I'm going to go ahead and get the miconazole out of the dispensing system. I'm going to check it against the MAR. Yes, this is miconazole, right dose, right route, and right medication. That's right. And I'm going to put it in the cup. And before I leave, I'm also going to check it again. Yes, that is the right medication, right route, right dose. And then I'm going to go ahead and head into the patient's room. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Okay, thank you. Are there any allergies that I should be aware of? No? Okay, great. I'm in here today to administer a vaginal suppository. This is for your yeast infection. So some side effects that you might experience, it might be kind of itchy. And something else that you need to keep in mind is that we have to keep you laying on the bed for 10 minutes after we put this in. What it does, it warms up to your body heat and then it melts. So we want to keep you laying flat. So if you need to use the restroom or anything, we can go ahead and do that now. Okay, are you sure you're okay? Okay. So we're going to lay here for 10 minutes, and then whenever you do get up, we can put a pad in your underwear because it might be kind of leaky. So you can be aware of that as well. So real quick, I'm going to perform hand hygiene and put my gloves on. I'm going to give you a look real quick. Okay. Something I'm going to do right now is I'm going to assess the skin, make sure it's not irritated. I'm going to wipe away any of the cream that was left behind or any discharge. So go ahead and assess. I'm going to keep her draped as much as possible. So I'm going to assess here. Okay, looks good. I'm going to wipe away anything. Okay, I'm going to go ahead and get the suppository, and I'm going to tell the patient to just take a deep breath and relax. I'm going to get it out, and I'm going to put it in the length of my finger tip. So that's about 10 centimeters. So I'm going to do that. I'm going to put it against the posterior wall of the vagina. Okay. So like I said, I'm going to keep them laying for 10 minutes. Okay, Miss Campbell, like I said, you're going to be laying here for 10 minutes, so it's going to melt. Like I said, it might cause some itching. Okay, that's normal. I'm going to remove my gloves and perform hand hygiene. I'm going to document the administration and tell her that I'll be back in about 10 minutes to check on her, and then she can get up at that time. Okay, right now I'm going to show you I'm going to demonstrate how to administer a Preparation H suppository. So first I'm going to go to my MAR, I'm going to look up the patient's MAR, and I'm going to compare the order, compare the MAR to the doctor's original order. This is the first time I'm administering the medication. So then I'm going to pull up the patient's medical record, I'm going to look at their medical history, their medication administration history, and I'm going to check for allergies. I'm also going to look up some information about this Preparation H medication that I can tell my patient. So then I'm going to go ahead and get the Preparation H out of the dispensing system. I'm going to check it with the MAR and make sure it's the right route, dosage, and medication, and it is. I'm also going to check the expiration date. So I'm also going to grab a cup, and before I put it in the cup, I'm going to check it a second time. Preparation H, right route, right dose, in the cup, expiration date in the cup. And I'm prepared to go ahead and go into the room. Something I'm going to need to grab is some Easy Lube. So I'm going to go ahead and get ready to go in the room. So, hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Okay, thank you. Do you have any allergies that I should be aware of? Okay. Alrighty, well, I'm here to give you a hemorrhoid suppository. It's Preparation H, and like I said, it's for your hemorrhoids. So, this medication doesn't really have a whole lot of side effects. The main thing is that it might be kind of uncomfortable going in. It might cause some itching, discomfort going in. That's the big one, okay? So I'm going to perform my hand hygiene and put my gloves on. I'm of course going to provide privacy for my patient. And I'm going to put them into the SIMS position for this administration. I am going to take my suppository, and it's bullet shaped. That's what the rectal suppository should look like. It's got a pointed end. I'm going to take it out of the wrapper and put Easy Lube on the pointed end. I'm going to tell my patient, okay, I'm going to put this in about the length of my finger. Just take a deep breath in and out. I'm going to pull it up. I'm going to push it into the rectum about the length of my finger. I'm going to try to push it against the wall so it'll melt whenever it gets in there. If I feel any feces, I'm not going to shove it into the feces. I'm going to try to avoid the feces and go against the wall. That way it absorbs correctly. And then I'm going to pull my finger out, and I'm going to wipe away any excess lubrication. And I'm going to provide privacy again. And something else I'm going to do while I'm doing this, I'm going to assess the skin. You know, if they have hemorrhoids, I'm definitely going to try to be really careful putting that in because those hemorrhoids are so painful. So I'm also going to want to assess their heart rate while I'm doing this because I don't want to stimulate the vagal nerve and have them pass out by any means. And also another side effect of this suppository is possible blood pressure, low blood pressure. So I'm going to have to monitor that as well. So now I'm going to take off my gloves, perform hand hygiene. I'm going to let the patient know that they have to stay flat, of course. And before I administer this, I would definitely want to tell them they're going to have to stay flat for a while. So I'd have to take them to the bathroom if they needed to go. And so I'll tell the patient I will be back here pretty soon. Let me know if they have any trouble. I'm going to document the administration, and I'll be done.